There we go. Hello, everyone, and Happy New Year. I'm so excited to see folks with us this evening as we're getting back into the swing of our monthly master classes. We took December off because December is just crazy. So we are so happy to start up with the new year and to have some more exciting topics for you this year. So I want to welcome you to our January Arts and Health Research Masterclass. And we're so grateful to AARP for funding this so that we can offer it free to all of you. This evening, we have Sonia Gow with us. She's the Program and Community Manager for Inova Parkinson's Movement and Disorders Center. I've known Sonia now for several years. She does a lot of work over at Insight in Fairfax, where we started our Sentimental Journey Singers. So she has been a wonderful advocate for us at Encore. And we are so grateful for her to bring her expertise and resources. That's the most important thing I think that she can offer is what resources are available to you in the area should this be something that you need or want more information on. So I'm going to turn the program over to Sonia, and we'll stop periodically for questions. If something pops into your mind, pop it in the chat, and I'll keep an eye on that, and we'll answer them as we go. All right, so Sonia, over to you.
Thanks, Marianne. Hi, everybody. I'm with the Inova Parkinson's and Movement Disorder Center, as she said, and I'm here to talk to you a bit about Parkinson's today, and also some of what our center offers. So I'm just going to share the screen, share screen, and take it back to the front. Nope, no, got a problem. There we go. Okay, so there we go. There's our information about our center. And we were 10 years anniversary last year, so we're excited about that. I want to talk to you about living well with Parkinson's for your own information if you have Parkinson's, but also if you want to share it with someone that you know that is living with Parkinson's. And I kind of think there's four elements to it. There's the specialist care and medications technology for that can help people alleviate symptoms, and exercise and lifestyle play a huge part in it as well. There we go. So what is Parkinson's? Sorry, I've got this thing here. There we go. Move that. A lot of you may be thinking that this old picture is like 200 years old actually, and it was describing Parkinson's as an old man stooped over and with a tremor, but that's not Parkinson's anymore. There we go. This is more like Parkinson's. People getting out and enjoying life and all that. All right, there we go. Sometimes people want to know what the cause of Parkinson's is. There's a lot of reasons for it. It's classically not inherited. So I think the thing that concerns people most is, are they going to pass it on to their children? So it's only a small percentage of people who are genetically disposed to it and pass it on within their families. I think a lot of times it's environmental. So it's a combination perhaps of, there's a lot of reasons for it, but I think that it's basically people have a predisposition towards it in their DNA, and then if they're exposed to toxic chemicals as well. There's a new book called Parkinson's Plan that came out last summer by Dr. Oken and Dr. Dorsey. And that talks a lot about the various toxic chemicals, like from, they were pointing out this year issues with the people who live near golf courses or dry cleaners, that sort of thing. It used to be more farming and military, but they're adding more sources to that. Okay, How do we diagnose Parkinson's? Well, first of all, the best person to see is a movement disorder specialist because they have additional fellowship training in movement disorders and they have the expertise and the knowledge of the e- various treatments for it, and also that they see more patients with Parkinson's. General neurologist is seeing so many people with so many conditions that they can't possibly keep up with all the treatments and everything that a movement disorder specialist can do. And sometimes you'll hear that, a general neurologist is an expert. They've been seeing people with Parkinson's for a long time, but that is not the same as a movement disorder specialist. And a movement disorder specialist has at least 1 to 2 years additional training. They're a neurologist to begin with, but then they have this additional training in Parkinson's. And then what can you expect from a movement disorder specialist? Well, they're going to look at your symptoms and your history, and they'll do an exam. And then they might see how you respond to medications, and we'll talk about that in a minute. There are a couple of scans, a DAT scan now, which is an imaging scan, as well as a SIN1 skin biopsy. So there's two tests now that can help confirm. It's not the only tool that you would use to make a diagnosis, but it's used in addition to the symptoms, the history of the exam, that sort of thing. And if you ever have someone that you know who's been diagnosed with a Parkinsonism, that's not really a diagnosis. Parkinsonism just means it's like Parkinson's. The symptoms are like Parkinson's. What you really want to do is narrow it down to what kind of Parkinson's it is so that you can diagnose it and then provide the right treatment for it. And the good news is that the life expectancy of someone with Parkinson's is the same as someone without it, as long as it's adequately treated. Yeah. Yeah. Here's some information about the SIN1 skin biopsy. It's been around for about 5 or 6 years, I think. But it's just a tiny little snip that they take from your neck area and your upper thigh and down by your ankle. And they take 3 little snips. They don't even need stitches for it. And then they send it off, and they're looking for misfolded alpha-synuclein proteins in the skin cells. And that will help with the diagnosis. And it's about as accurate as the DAT scan as well. It's just a lot less invasive and a lot less costly. And what happens if you have, oh, yeah, so back there, I forgot to mention that Parkinson's is simply a dopamine deficiency. It's not a structural fault or anything. It's just a lack of dopamine, just similar to how a diabetic would have less insulin. And what happens if you have reduced dopamine? Well, we divide up the symptoms into motor and non-motor symptoms. The motor symptoms are the ones that we can treat with the medications, most commonly a tremor, but not everyone with Parkinson's has a tremor, and that can sometimes make diagnosis even more difficult. It's generally that the tremor for Parkinson's is one when you're at rest. With essential tremor, it's more when you're moving. So if I had essential tremor, I would not be able to hold this glass of water properly. But with Parkinson's, I would have a better chance of doing that. My tremor would be when I had my hand in my lap, perhaps. Bradykinesia is the slowness, rigidity, and the stiffness. Those are also key motor symptoms for Parkinson's, as well as the slow walking and the shuffle. The picture on the side shows someone walking with Parkinson's in the shuffle, and then someone without Parkinson's having a more pronounced stride. Balance issues are common, as is a reduced facial expression and speech changes. Speech can often be much more quiet. These are some of the features of Parkinson's. Like I just said, the reduced facial expression. The emotions don't always show, and that is upsetting for some people. A gentleman once told me he couldn't smile because he has Parkinson's, and I said, I can always tell when you're about to say something that your wife is going to disapprove of because it would show in his eyes. So The reason for the raccoon here is it's the mascot for international conference called the World Parkinson's Congress, and they'll be meeting in Phoenix this year in May, and they chose the raccoon for the masked face. Yeah. And yeah, that's my Parky. And Parkinson's is basically about being slow. Everything with Parkinson's is slow. People can be slow to respond when you're talking to them, so please give them time. Please be patient. And also, they can be stiff and slow to move as well. So, what's the best way you can help people with Parkinson's? I always say it's patience. Just give them some time. See, these are some of the examples for non-motor symptoms. Often people find these more upsetting than, or some of these more upsetting than the actual motor symptoms. The four at the top, the loss of the sense of smell, constipation, the talking in sleep or acting out in dreams, and the anxiety and depression, those can all be present for years before diagnosis, 10 to 20 years before diagnosis. Um, People don't often like to talk about constipation, but it is very common, and it can slow down the medications, especially the oral medications. And the loss of sense of smell is something else that I hear is common. There are other issues as well because Parkinson's affects the whole body. So we're dealing with the bladder, saliva, vision changes, problems with sweating, either too much or too little, lightheadedness and dizziness on standing, orthostatic hypotension, fatigue and skin problems are just some of them. There's different avenues of treatment. Most commonly, the levodopa replaces dopamine. Other ways are for medications to stop the breakdown of levodopa or mimic dopamine or slow the breakdown of existing dopamine. I'm not going to go into all the different kinds of medications. There's 24 different ways to treat Parkinson's these days. But I just want you to know that there's different kinds, different approaches for this. And the best thing to do is to talk to the doctor, let them sort out what the symptoms are and what you're not able to do with that you want to do, and then they can provide the medications that will best help you. And so carbidopa levodopa is probably the most common medication that's prescribed. The one up the top there, the Sinemet, is the classic carbidopa levodopa. Sinemet was the brand name, but it's generic now. And it's a chalky yellow tablet. It's been around since the early 1970s. Some people are still on that, and their doctors don't know to prescribe other variations of it. About 80% of people across the US are still only know about Sinemet and not the others. Rytary came out in 2015, it's like an extended release, but it's now gone generic as well. It's now known as carbidopa levodopa ER. But because in last year, or maybe the fall before, Crexont came out, and that's like a much better version of the extended release. It works differently and is more effective, so it is actually helping people. It lasts longer than the initial Sinemet or the Rytary. So Sinemet has a lifetime of about 90 minutes, whereas Rytary is a bit longer. It all depends on the individual as well. Vialev at the bottom is a new device that came out about a year ago. It's phoscarbidopa, phoslevodopa, and it's like in a way, like an insulin pump. It's subcutaneous infusion device, and it's worn 24 hours if you want, and it's helping people to sleep better and avoid issues with protein that some people have with oral medications. And it's good because it provides a continual release of carbidopa levodopa, and the brain prefers that to the up and down of the previous versions of the oral medications. The oral medications sometimes don't always work that well if people are constipated and not drinking enough water. The Bilev um, works through the skin rather than the digestive system, so it works around that. Just want to make a point here that I'm not a doctor. I'm not a clinical person at all. So I'm just providing some basic information so that you know what's available out there and can talk to your doctor about that. So just wanted to show you here that these are all most of the different kinds of medications that are available now that help with different things. Nuplazid is helpful for hallucinations, and there's all these other medications that fit into those four categories that I spoke about before. Really important is the timing of medications, particularly with the oral medications. There's very little flexibility in scheduling, particularly with the older ones. So when the doctor says that you need to take them 4 hours apart, that's exactly what they mean. We have this problem a lot when people are in hospital, trying to get the hospital team to make sure that the patient gets their medications on time. You won't go to hospital because you have Parkinson's, you'll go for something else. And sometimes the Parkinson's gets put to the side and not treated as well as it needs to be so the patient can recover properly. And timing of protein and meals happens with some medications, some of the oral medications, but not all, and not everyone. I was talking to a gentleman this afternoon, and he's like, I don't get what this thing is with protein, because he doesn't feel any different when he has protein. But some people do. Some people feel that their medications aren't working as well, and that's because they're kind of competing with the protein in the brain. Sometimes people think that the medications stop working. That's not really quite right. It's that our bodies change over time, and Parkinson's progresses. So there are ways, the medications need to be adjusted. When you're first diagnosed and the doctor prescribes medications for you, it might take a little while for them to work out with you what the best combination is for you, because each of us, we're all individuals. And particularly with Parkinson's, if you know one person with Parkinson's, you know one person with Parkinson's. So seeing your relationship with the movement disorder specialist is ongoing, and they can help adjust the medications over time. Like I said, there's some of the medications are complementary, and we also have some targeted technologies as well. These are some of the targeted technologies that I just mentioned. Botulinum toxin injections can be helpful with drooling and cramping. Excuse me. Vialib was the subcutaneous pump I just showed you. There's another medication called Onapgo, which is apomorphine. Nothing to do with the painkiller, not related. And that's also a new medication that's come out. Same idea, that's a subcutaneous pump, but it can be worn 16 hours a day, not 24. And it sort of complements the carbidopa levodopa. It helps it work better. Focused ultrasound is an option. Not so sure. I understand it's not that good for Parkinson's, maybe better for essential tremor. And then deep brain stimulation, and that's something else that our doctors can help with. And we offer that at Inova. It's a couple of leads that are put in the brain and attached to an electronic device similar to a pacemaker. And there are 3 different companies now that offer it. So you have your choice of device. And yes, it's brain surgery. Therapies are also really important. Physical therapy, occupational therapy, and speech language pathology. A lot of people think that speech pathology is only for voice. And I know that's where you're all coming from, but it's not. It's also for swallowing and cognition. So yeah, we recommend that people go for therapy when they're newly diagnosed, so they get a baseline with their therapist, and sort of think of it as a maintenance program. This is someone you want to work with for the rest of your life, so they can help you. It's often easier for them to maintain what you have than if you let it go and then they try to restore what you've lost. So. There are Parkinson specialists in our area, and we have a list on our website for IPMDC.org where we can recommend the teams, the Inova Hospital outpatient rehab teams, as well as some community teams that can help you in your home. Sudden changes are usually not Parkinson's. Yeah, if I get a phone call from someone and they're frantic because something's changed quickly in the last, even if it's just over a couple of days, um, it's not Parkinson's. Everything about Parkinson's is slow. So usually something that changes quickly when someone is acting strangely or not doing well, it's because they're dehydrated. A lot of times people don't want to drink water because they don't want to have to go to the bathroom all the time, but really I think I would rather go to the bathroom a lot than go to the hospital. So dehydration, and please drink more water. Bacterial infection can also be caused by that, and urinary tract infection and pneumonias. The bacterial infections, dehydration, falls, those are probably the most common reasons that I hear about why people are in hospital with Parkinson's. But yeah, a lot of times people think it's their medication's not working, but no, if in doubt, check it out with your GP, with your primary care. So now we're coming to, that was some of the basics about Parkinson's. Just want to talk to you a little bit about our center. We are a comprehensive Parkinson's center, and we do offer the highest level of clinical care. And then we have programs and resources for all the days in between. This is my team. These are the doctors I work with. Dr. Falconer and Dr. Rogers, they founded our center in 2015, and we've since been joined by Dr. Whitney and Dr. Lawler and Dr. Reedy. We had another doctor with us last year, Dr. Irving, but she's moved to the West Coast, and we will be we are working on having someone come and replace her. Dr. Scott is a neuropsychologist. She specializes in functional neurological disorders. If you know anyone with that, we have a specialist now. And Dr. Palderoy is our cognitive and behavioral neurologist, and now she's newly appointed director to the Memory Disorders and Brain Health Program. She does a lot of talks at Insight Memory Care Center too, mostly for their caregiver boot camps. Yeah, and there's going to be a conference in November, the Northern Virginia Dementia Care Consortium. I remember when Encore sang there, I think it was 2016 or 2017. Yeah. So she's going to be helping with organizing that and the speakers and stuff now going forward. We also have 2 nurse practitioners, and I believe we're getting more, and some nursing specialists that all specialize in Parkinson's and movement disorders. So my point is that today I facilitate 6 support groups, and I was with one group today, and a gentleman was talking about how he thinks his grandfather had Parkinson's. He was born in the 1890 something. I think it was 1899. And when he was back in the 60s, the person who was speaking to us today thought that the way some of the things that the grandfather was doing, he wasn't diagnosed with Parkinson's because there weren't treatments in that for them then, and the gentleman suffered a lot. So the gentleman today was saying that he was kind of grateful that he was diagnosed when he was, because of all the treatments that are available, and we know that exercise and lifestyle choices can make a huge difference as well. That was the first time I've ever met anyone who knew someone who had Parkinson's before carbidopa-levodopa was available in 1974. So that was interesting for me. But the right medications and the treatments are the key to living well. They help people to get moving. But the other part, just as important as the clinical care, is exercise and lifestyle choices that we can make. So here we go. So living well with Parkinson's is about the right meds, also challenging exercise, not just any exercise, but it needs to challenge you. So something that does challenges your body and your brain. At the same time, eating well, reducing stress, getting enough sleep, staying mentally active, social interactions, all these things that you're doing with Encore. I think it all ties in together, and music is magical for movement as well. those are the key points. And it applies to us all, right? Whether we have Parkinson's or not. Getting enough sleep is going to help us feel better and function better and remember things better. And eating well is part of all that as well. And exercise is huge. The studies show that exercise is as helpful, if not more so sometimes than medications. So it's not just one or the other, but it's the way the two work together that are magical, and movement is definitely medicine. About our programs, we offer over 100 programs a month now, online and in person, at multiple locations throughout Northern Virginia, so that we're trying to bring the programs to everyone, so it's not so hard for them to travel. We offer educational programs and exercise and wellness, and also social and supportive. So I think we all learned during COVID how important it is to also hang out with each other and not try to do things on our own, spend too much time on our own. We specialize in featuring Parkinson and community experts, and our programs are open to anyone with Parkinson's and their families and friends, anyone who wants to learn more about Parkinson's. It's not just limited to Inova patients. And we're also working on educational programs for allied health professionals in the senior living space. And so this is just some of the programs that we have that we offer. Our programs, our online programs, many of them are coming from a couple, Josefa Domingos, who's a Portuguese physiotherapist, and her American speech language pathologist husband, John Dean. They're producing these programs out of Lisbon, Portugal, which is why they're online. But they do come to town a couple of times a year, and they offer a boost camp, which is basically their dual task Parkinson's for in person for a day, and they're a lot of fun. And they're really great with our educational programs as well. Um, they're able to refer to studies and clinical things. What I really love about their educational programs is they send out a email the week before and with a survey. So instead of doing Q&A at the end of a program, they do it beforehand, and then they incorporate the answers into their presentation. And you can see how, your answer compares to other people as well, and realize that you're not alone in some of the things that you're thinking and you're feeling. We also offer Let's Chat About Thinking with Dr. Palderai, who's our cognitive behavioral neurologist, and she's brilliant at explaining things and like from the perspective of the patient. And so really helpful hints for family and caregivers. We have a healthy eating program, and also a program by Maria Spatelnik, Live a Simpler, Safer and Less Cluttered Life. And she's a professional organizer and hoarding expert. But yeah, her program is really popular, and she's helping us get our act together and get motivated to downsize and declutter and just organize stuff, paper stuff as well as the other stuff we have in our lives. Something that might be of interest to you all is the bottom of the in-person list is improv for movement and memory. This is something new that we're offering, and we're working with Insight Memory Care Center on it. So it's, I think, the third Thursday at Fairfax Insight, and the fourth Thursday at Sterling Insight in the afternoon. And it's open to anyone, with memory and with movement conditions. And what we're finding is that because there's no wrong answer for it, it's a lot of fun. You don't have to worry about getting the answer right. There was a gentleman who participated in one of the early classes, and he still goes, and he was having trouble finding the right word. And so they did an exercise where it was all gibberish. You could just say whatever you wanted to, just rubbish. And he loved it because he didn't have to think of the right word. He could just make stuff up. And so, yeah, so they'll adapt the activities towards the people who are in the room so that everybody has a good time. And we also offer a brain choir out in Loudon Hospital. The outpatient rehab team there offers a brain choir. It used to be the stroke choir before COVID. Yeah, Marianne's nodding. Yeah, so then they opened it up to everyone. by making it a brain choir after COVID. They do that with, oh gosh, music therapist out in a place to be in Middleburg. Yeah. Okay. But we do encourage people to join in on your encore programs too. And I understand that there, Ashby Ponds is doing that. We have a group there as well. Okay. Just some other resources through IPMDC.org. That's our website for programs and resources. We have a newsletter I send out every Monday morning. There's a calendar with all our programs. It's in IPMDC.org is basically a living document. I'm on it every day, updating it. It has resources. It has libraries of our recordings. I can even put this one on there if you want. And we have a special page for patients in hospital. That's our patient care kit. And we also have hard copies of the forms on that page that we can share with people. One of our doctors, Dr. Reedy, has mostly done the writing for PD 101, just some of the basics on Parkinson's that he shares with patients through their after visit summaries. And then there's a list of and information for all our online and in-person programs. And we can offer these programs for free thanks to the extremely generous community that we have that makes it all possible. And we're very grateful for that. And that photo is of our October Boost Camp at the Inova Conference Center. And we have a lot of fun there. Yeah, Josepha's the one with the striped top at the front. And she's the brains behind all that. So our programs are offered for free. We think it's important that if we're going to tell people to exercise and hang out with each other and learn stuff about Parkinson's, that we make it easy for them. And this is my page for contact information. On the blue side here, to schedule an appointment, that's the number you would call to schedule an appointment with one of our doctors. And that's the Inova website, inova.org/move, that has information about our team and the services we provide. And on the other side of the page is what I do. And you're always welcome to email, works best for me. But yeah, I'm happy to help you if you have any questions about Parkinson's. And if you want to learn more about our programs and get updates every week, then that's why we have our newsletter. And I think that's it. Yeah, that's it.
Wonderful. So just going through, there were a couple of comments in the chat. If I can get that to work for me, it's being very stubborn. There we go.
I can see them.
Yeah. So Elizabeth was asking, are these all free? And
Yes.
you emphasized that yes,
Yep.
they are. So that's absolutely wonderful. I know that that's quite a feat to do in terms of fundraising to make sure that you can do that. So that's really wonderful. And then Martha brought up she's a singer with us. She's a retired neurologist,
Ooh.
and she was in her training when levodopa was introduced. And if you all have seen Awakenings with Robin Williams, that's all about that, and Oliver Sacks and some of his work,
Yeah,
and
that's where it
which is
started.
yeah. Um, so wonderful. We're a rather small group. If there are other questions and you're more comfortable unmuting and asking, I think we can certainly do that. If you would still like to put it in the chat, I'm happy to read it out for you. Don't be shy. It's the first one since we're back from holiday break, so we got to get back into it. Any questions or thoughts or?
I want to thank Martha for her comment. That's so cool. I mostly live in a world where people have Parkinson's in the last 10 or 20 years or whatever, and I don't know anyone who's worked with people from that far back. That's cool. And yeah, Awakenings is where it all started, as far as treatment goes. And then there's another comment from Sheila about she worked with an attorney who developed Parkinson's in his early 70s. So yeah, it is more commonly diagnosed when people are older. It's thought of as an older person's disease. but we're finding more and more young people are being diagnosed with it. There's an organization called the Young Onset Parkinson Network
Hmm.
for people under 50. And there are unfortunately a lot of them. So these are our kids, you know, um, who who are raising families, young families of their own, and maybe trying to help their parents as well, and they're not that well themselves. So that's a lot to juggle, and they have issues that are, for the reasons I just mentioned, that are different from when people are older and diagnosed. And Parkinson's can be a little bit different too for the younger ones than the older ones.
Hmm. I know Matt was asking if the slide deck is available. The easiest thing that we do is we record. We're recording this presentation, and then we will send out a link to the presentation, and you can come back and view and stop and pause and go back and forth in the presentation. That's probably the easiest way to access that.
But I can send it to you too. I can send you a PDF of it.
Okay.
Yeah. So my contact information, I'll pop it in the chat. Um,
And while she's doing that, Francine, I see you have your hand up.
mm,
Yeah, so I'm dealing with a friend of mine who lives in DC. She had polio when she was young, so she only has her mobility is affected. She needs a wheelchair, and her husband has developed Parkinson's, but it's so advanced that he's has psychotic episodes, and he was just put in a hospital because they changed his medication and it became worse. So now she's alone in the continuing care facility, but the facility she's in says they will not be able to accept him in the skilled nursing. And I mean, it's just a complete disaster. So she's alone, unable to really go even to the hospital unless somebody helps her because she has to get into a wheelchair once she's get out of the car. And if they put him on the other side of town, I mean, she calls me every day and I'm like, it's a horrible situation, but it's completely affected his mind.
yeah, there is a particular medication specifically for Parkinson's. You have to be careful with Parkinson's and mental health and antipsychotics. So there is one for hallucinations called Nuplazid, but it takes a while to kick in. So one of the things that people can be dealing with Parkinson's now all these symptoms that I showed you earlier on, that doesn't mean that everybody's going to get all of those things. It's very individual. But for people who experience hallucinations, a lot of times initially they're friendly or they're not scary. They're cute little kittens in the corner, and you're like, oh, I can deal with that. And it might be embarrassing to talk to your doctor about seeing something that you know isn't really there. Um, and so people tend not to talk about it when it's not as harmful. And then we have situations like with your friend where it turns bad and then they end up in the ER because the family doesn't know what to do with them. When they're in hospital, one of our biggest concerns is that people with Parkinson's should not be given Haldol. That's a common medication for people when they're agitated in hospital. Works well with just about everybody else, but it's really not good for Parkinson's at all. And that's what we show in our patient care kit. We ask people, we make it clear to the hospital and the rehab team, please do not give Haldol. The person will not recover as well as if they weren't given it. So for hallucinations, when they're in hospital, there are medications that they can prescribe that are more suitable for Parkinson's. But the trouble with Nuplazid is that it takes about 4 to 6 weeks to kick in. So then the doctors need to be very careful about the medications that they prescribe in the meantime to keep the person stable. My recommendation when there's a situation like that is for people to work with care managers. I love working with care managers. They're just awesome. I can recommend some that specialize in Parkinson's and have done trainings with our doctors to educate their team on how to provide the best care for Parkinson's. And
That would
they
be great.
they know how to talk to the people in the hospital. I like working with nurse care managers who are nurses for that reason, because a couple of them really understand the Parkinson medications. What one lady in particular, she helps me with my educational programs for healthcare professionals because I'm not clinical, but she is.
Hmm.
So yeah, she has a really good understanding of it, and they can go in there and really advocate for the patient and find a place that will accept him.
Right.
Like maybe
She lives in DC.
okay. Our special
Maybe I can give you my email in the chat and you might be able to send me.
yeah, if you're okay with that, if you put it in the chat, then everyone else will have access to it.
It's okay.
Why don't you email me? My email's in the
Okay. Okay.
sonia.gow@inova.org, and we'll see what we can do to help you. But yeah, that's a really hard situation, especially if he can't go to the community where his wife is, and she has
Right.
mobility issues too. Yeah, I'm sorry about that.
And she's all alone. Is there anything to help her also?
Yeah, the care managers will do that.
The care manager. Okay.
Yeah, yeah. They have a better understanding of the resources for this sort of thing than I do.
Okay. Thank you very much.
No, you're welcome. I hope we can help.
In the chat, Janine asks, can you say more about the potential toxic chemicals cause for PD? I know I heard you say golf course, and I thought, oh my gosh, how many of these people are living in a golf course community?
Right? Yeah, yeah. Well, when you think about all the pesticides and whatnot, um, herbicides, yeah, that are poured into the golf courses to keep them nice and green and all that. There are issues for veterans. There's information for veterans if they were in Vietnam and exposed to Agent Orange. There are special benefits for them because that's, of course, toxic. And also for families who lived at Camp Lejeune, the water was bad there. So there are veterans benefits for families there. What else? Yeah. Um, so the Parkinson's Plan is the book that I was talking about by Michael Okun, Okun, and Ray Dorsey. Um, I'm not at my desk right now, otherwise I'd show it to you. But it's available from Amazon, and they talk a lot about pesticides and herbicides and how to avoid it. Unfortunately, the book is more aimed at prevention than what to do if you have Parkinson's. I don't, yeah, I suppose you can slow the progression in that if you can avoid chemicals, toxic chemicals, but it's getting harder because they're everywhere, plastics and whatnot. Um, but yeah, eating whole foods and getting sleep and reducing stress and singing and music and all that sort of good stuff, that'll all help us.
Good. Matt also says, my spouse's physician indicated that the disease progression is likely to lead to full disability or death within 10 to 15 years due to the type of PD. However, your presentation indicated that PD doesn't shorten life expectancy. Can you say more?
Yeah, I work with a team of doctors, and our message is about hope. Um, I, I'm so sad when I see doctors do this sort of thing. There are all these medications available now. That might have been the case a while back, but not now. The medications are there, and they can help. And yeah, and my statement about the life expectancy isn't shorter with Parkinson's. It's if you have the adequate treatment for it. So that's another reason to see a movement disorder specialist. But when combined with exercise, we've got people who were sedentary um and all that, and they're more fit now with Parkinson's because they realize the value of exercise and voice speech, all that sort of thing. Um, yeah, there's some people I know now. They're climbing, they're dancing, they're boxing, they're doing really cool stuff. Our programs are not sort of boring chair exercises and sets and reps that used to be when I started off as a fitness instructor. It's more about um, dual tasking and challenging yourself and doing feeling more like an athlete than a patient. Yeah, I really see the difference when the people are getting the right treatment so that they can move, but are also exercising and socializing. Um, it just makes such a difference. And if they're being consistent about it, you can walk into one of my support groups and you'll wonder who has Parkinson's. Yeah, you won't be able to figure it out.
Great. Sheila asked if you could speak a little bit more about prevention, what we can do.
Yeah, about prevention, I recommend the Parkinson plan. Um, it goes into more detail about that, and it's doing all the things that we know whatever your mother or your grandmother told you to do, how to eat and how to sleep and things to do. Yeah, we need to listen to our mothers and our grandmothers, um, because it's for all of us. Um, a lot of it is environmental, and is exposure to chemicals as far as we know. It can also be not just ingesting it, but also breathing it in. I think that's what this book talks about. So, the loss of the sense of smell makes you think, maybe that's because they were breathing in chemicals. Um, Also, they also sometimes think that Parkinson starts in the gut. So maybe that's from what we were eating, if yeah. So it's not 100%, but just do the best we can.
Are there any other questions? I think I covered everything in the chat. Are there other questions? Peggy, are you raising your hand? Can you unmute? Because I can't unmute you. That's the only trouble with Zoom.
Yeah. We can't hear you, Peggy.
Let me see if I can.
Can you ask her to unmute?
Yeah, I'm trying to find her on here. There she is. Maybe did you get a little pop up, Peggy? There we go.
Okay. Thank you.
Yay, we will conquer it.
I just have a simple question. I live in Massachusetts, and do you have similar programs up here,
Mm.
like Encore?
Oh, I'll let you answer that, Marianne.
I think she's asking about the Parkinson's programs. Like we have Encore
Oh,
across the country.
yeah, yeah. So you're welcome to join in any of our online programs. We have people joining us from all over the US and Europe and Canada, even somebody from Australia. So yeah, you're welcome to join in our online programs, and there's a variety there. There is probably a Parkinson there are several national Parkinson organizations, and they might have chapters up your way. If you want to email me, I can have a look for you if you like.
Okay. Thank you.
You're
That's all right.
welcome, Peggy.
I can
Um,
go on the website too and look for it.
No, so I don't have a lot of information for other states, but I'm happy to help by email.
Okay. All right. Thank you.
you're welcome. Beth, I see that your hand is up.
Yes, thank you. Um, I have a friend, um, and he lives in Phoenix. He's pretty advanced in his Parkinson's. He hasn't walked in about 6 years.
Oh dear.
And as soon as Encore, he used to sing beautifully. Like, you know, In high school, he had the lead, in two musicals, and beautiful baritone voice. And he went into broadcasting, using his voice there. But he doesn't use it at all now. And I have tried since Encore has been in Phoenix to get him to go. And he's not, at least so far. He says it would be a lot of work for him to get there. Is there anything that I can say, that would be truthful and persuasive?
Yeah, I would suggest you see a speech language pathologist, and they can do a lot for him and assess him and let him know what his possibilities are and work with him and maybe help him find his voice again. And a physical therapist might be able to help him get there physically. Yeah, that's and there. I was going to say I'm not sure if they're in Phoenix or not, but here in Northern Virginia we have Fox Rehabilitation, and they don't have a clinic. They only go to people's homes. So there's possible that somewhere in Phoenix that you've got something similar, if not the same, where the therapist will come to the home, and then that helps him with transportation, right?
Right.
I also, I had a gentleman when I first started my church job that had been diagnosed with Parkinson's several years before I had gotten there. I had no idea. He sang in the choir, he played harmonica at church because he was so active. And so he sang all the way up until maybe the last year, maybe a little over a year. Because of course we talk a lot at Encore that it's not just the singing, right? It's the socialization and the movement and the energy through the body and all the things. So,
Right.
even if there's, another type of singing group that may be more, easier for him to access. That might be the way to go as well. If there's something at a community center or a memory cafe or, some of those things that may be a little bit easier for him to get to.
And this conference that I'm going to in Phoenix in May, this World Parkinson Congress, they have a choir. They're practicing now. It's international. And I went to the conference in Portland in 2016, and they had been practicing online, and then they came a few days early so they could practice in person. Every time I watch that video, I'm in tears. It's just so beautiful because people with Parkinson's so often think they don't have, that they've lost their voice, that they can't sing anymore. And yeah. So if you Google, I think it's WPC 2026, and you'll see information about previous congresses and the choirs that they've had, and it's just so moving. It really is. Yeah, so tell your friend people with Parkinson's are still singing, and you can do it through Encore or you can do it through Parkinson organizations. And yeah, it's there there's such a feeling of loss of control with Parkinson's. You can't control your movements, you can't control how fast you respond, all these things, but yet there is still so many things that people can control, and that's what we want to focus on and emphasize. It's not what they've lost, but it's what they still have and what they can make the most of what they have. That's what we're trying to do. I
Barbara,
think
I see your hand
Barbara,
up.
yeah.
Sorry. Can you hear me?
Yep,
Mhm.
gotcha.
I want to take this moment to shout out Inova's support of a program that I am astounded I became a part of. I was diagnosed just about a year ago. I'm dreadfully afraid of heights, but I'm now a rock climber because of upending Parkinson's. And the key is don't look down. Just keep looking up. And I can't imagine anything else being as helpful because of the I still don't know how to quite word it, but neuroplasticity is the key word of how it encourages my brain to think about every movement I take. I'm also a swimmer, and the tightness in my body has made my swimming more difficult. But if I swim after climbing, I have full control of my body. And I'm so excited that you guys do this. And people that don't live in this Northern Virginia area can go to the Upending Parkinson's website and see that they pay for everything, and they have volunteer belayers all over the country. They have about 60 or 70 of them. And I thank you guys for supporting that.
Yeah, thanks for that. I think I know who you are. I get the attendance sheets, but so I don't often know people by their faces. You probably know someone called Teresa, and her last name starts with a B. Um, she credits climbing for helping her with depression, and when I first met her, she was newly diagnosed, and we told her about the climbing, and she was really struggling with depression, and she said the climbing just made such a difference. And they tell me that if you have anxiety, when you get to the top and you get back down again, you're cured. Because you feel like you could do anything once you don't do it the first time. Everybody's frightened to do it,
Yeah.
but that's what I'm told anyway. Yeah, but it makes such a difference. So it's not just physical, and it's also mental health and anxiety and depression, which are very common with Parkinson's. And the support with the climbers is almost palpable. It's the most beautiful thing I've seen. It's also with the climbers, sorry, with the dancers and the boxers since then, but I first noticed it with the climbers. They're so supportive of each other, and the program Upending Parkinson's is sort of based on adaptive climbing. So they also offer at Sport Rock climbing for people who've had a stroke or who have lost a limb. So that's one of the reasons they're able to do this with Parkinson's. And we have people who have trouble walking into the gym, and yet they can climb with these. Yeah.
And we also have a blind woman who's,
Yes. Yes. Yeah, I know her. Yeah. She has Parkinson's, and she's blind, and she climbs. So
yes.
it's like no excuses anymore. And the oldest one is 90, so don't throw age at me, because I'll throw it right back at you.
That's great. Thank you.
Yeah, thank
Mary, I
you.
see your
Yeah.
hand. Yep, Mary, what you got for us?
I was wondering for Beth, does her friend have a computer? Is he computer literate?
He does have a laptop and a cell phone, and he's semi-literate. I'd say he's kind of fallen behind since he's not able to work for some time.
I know what the ONOFF switch does. That's how literate I am. But I was just wondering if he could possibly join the chorale online and sing along with them.
It's a possibility, and I have asked him about that. I've, done the online, and I find it wonderful. You kind of picture it as being lonely and, not very good, but with the instructors like Jacqueline, it's
Oh, yeah.
fabulous. It's and Joey. I mean, I would, do the online meetings just for Joey,
And he doesn't have to leave the house.
Right.
That's the main thing. Give it another try.
I'm texting him right now about the conference.
Great.
So also, Beth, on a similar note, we offer a voice, speech, and communications class at 12 noon on Tuesdays, and this is with John Dean out of Portugal. He's an American speech language pathologist, but he's
Oh,
incorporating singing lately.
Mm.
So it would, and that's online. It's free. You can just go onto our website, look under online programs, ipmdc.org online. Actually, it'd be, yeah, I have to look it up for you. I'll look it up in a minute. But yeah, that would help him with his voice. It's not a replacement for therapy, but it would be an additional to, because it's a class. But yeah, he might have, and you know what we found? Even though it's online, we started these programs in like 2021. We realized after the first year when we brought people together in person, when John and Josefa came to town, that we had created an online community. They all knew each other because they would come on beforehand and chat with each other or stay on afterwards. And then when they saw each other in person, it was just heartwarming.
Mm-hmm.
So yeah, don't knock the online. You can still have communities online, right, Marianne?
Yes, absolutely.
Mhm.
Absolutely. Great. Any other questions?
No.
Let me scroll through my screens too. I want to make sure I'm not missing anybody. We have a good group. We've got 2 screens worth of folks on.
Okay, so I just put the link in for the voice, speech, and communication, but it's on IPMDC.org. And if you have any hassles, just email me. I'll put my email in again, and I can help you find stuff.
Yeah, it is. It is amazing, as Sonia said. A lot of the programs that Inova takes works with are national programs. So things like Dance for PD is based in New York, and there's several groups in this area. There's groups all around the country, and there's now developing our Singing for PD groups specific. As well. And so I don't know if they have a national association, but I'm starting to see that appear in different places as well. So,
Yeah, Dance for PD offers Singing for PD.
okay, is it through their organization? Oh,
Um,
okay.
I don't know if that's the same thing that you're referring to, but I do know
Okay.
that they offer a singing class, and I believe it's online.
Okay. Yeah, so there's lots of things out there. As much as we want folks to come to Encore, we want to spread the word about other things too, because we can't do it all.
Yeah. And upending Parkinson's, the climbing, that's moving across the US as well too.
That's great.
Yeah.
That's great. Good. Other questions? As I say in my rehearsals, going once, going twice, because as soon as I move on, somebody says, "Oh, wait." All right, let me see. Just some thank yous popping into the chat. Yes, thank you so much, Sonia,
Yeah.
for being here with us this evening. You know, part of what Encore wants to do, as I said, is spread information about resources that we all need. Or we might know somebody who needs them. So, again, this is recorded, and so give us probably till the end of the week. It has to process and things before we can post it, but we'll send that link out. And then if there's somebody that you think can benefit from this information, please do share it, because we want to help everybody get resources that they need. So thank you again, Sonia,
You're
for
welcome.
being here this evening. And thank you to all of you for joining us this evening. And again, thank you to AARP for sponsoring these master classes so that we can offer these great resources and information to all of you. So have a wonderful evening. Again, Happy New Year. And I know we'll see many of you in person in a few weeks when our rehearsals begin. And have a wonderful night. Thank you so much.
Thanks, everybody.